All right, let's jump right in. We're going to talk about the difference between knowing a bunch of facts and having real wisdom. And to do that, we're going to look at a situation where that difference is, quite literally, a matter of life and death. A cardiac arrest.
How did I miss that? That's the one question nobody ever wants to ask, especially not a doctor. This came from a junior doctor, Dr. Purva, right after her senior colleague saved a patient that she was absolutely sure was gone. A huge mistake was made, and figuring out why, well, that's the key to this whole story. So here's the scene. A patient's heart stops. Dr. Purva looks at the monitor and sees a flat line, textbook asystole, so she starts the protocol. But then her mentor, a doctor named Dr. S.B., comes in, takes one look, and sees something completely different. Hidden in that flat line, he spots a tiny, faint, chaotic rhythm called fine ventricular fibrillation. He yells for a shock, they deliver it, and bam, the patient gets a pulse back. You see, Dr. Purva saw a fact on a screen. Dr. S.B. saw a hidden truth that saved a life.
So how in the world did he see it? Well, Dr. S.B. explains it with this really powerful metaphor. He says the monitor was full of smoke, all that electrical interference and fuzziness, and that smoke was hiding the fire, the heart's actual rhythm. Dr. Purva saw the smoke and, she stopped there. But Dr. S.B.C. had the wisdom to look through the smoke to find the fire. And this is where it gets really fascinating. Dr. S.B. breaks down this difference using these two ancient concepts. On one side, you've got Jnana. Think of that as your textbook knowledge. It's knowing what to do, it's recognizing patterns, it's following the steps in the algorithm. But on the other side, you've got vijnana, and that is true wisdom. It's understanding why you're doing what you're doing. It's that deep insight that lets you guide the treatment, not just follow a recipe. This quote from the Bhagavad Gita just nails it, doesn't it? It says our wisdom, our vijnana, it's always there, but it's so often covered up by the smoke of our own ignorance or just, incomplete knowledge. The real challenge isn't just to memorize more facts, but to learn how to see clearly through all that smoke. All right, let's get practical. When a patient is in cardiac arrest, everything comes down to one single question right at the beginning. Is this a rhythm you can shock or not? Getting that one decision right is absolutely the first, most crucial step. So let's start with the rhythms where electricity is the answer. First up is ventricular fibrillation, or VF. This is just pure electrical chaos. The heart isn't beating, it's just quivering, totally unable to pump any blood. Now, the jnana, the basic knowledge is VF gets a shock. Easy enough. But the vijnana, the wisdom, is knowing why. That shock is like a giant system-wide reset button. It stuns the entire heart all at once, giving its own natural pacemaker a chance to hopefully take back control. So how do you avoid the mistake that Dr. Purva made? Well, Dr. S.B. gives these 4 critical rules. First, think about the context. If you just saw someone collapse, a true flatline is pretty unlikely. Second, you've got to check the rhythm from different angles, using multiple leads. Third, crank up the gain. Make that line on the monitor bigger to see if you can spot any of those tiny little wiggles. And finally, and this is the big one, any little undulation, any little wiggle at all is VF until you can prove it's not.
The only other shockable rhythm is something called pulseless VT. Now, this one looks a lot more organized than VF, but don't let that fool you. The rhythm is so ridiculously fast that the heart has no time to fill with blood between beats. So what's the result? No pulse. The patient is clinically dead. The vijnana here is realizing that even though the pattern on the screen looks different, the reality for the patient is exactly the same as VF. No blood flow means you treat it the same way with a shock.
Okay, so we've covered the shockable rhythms. Now we're moving over to the other side of that decision tree. For these next 2 rhythms, hitting them with a shock is totally useless. Why? Because the problem isn't the heart's electrical wiring anymore. It's a mechanical problem. This one is called pulseless electrical activity, or PEA. And it can be so deceiving because you look up at the monitor and you might see what looks like a nearly normal rhythm. The electrical signals are there, but when you actually check the patient, there's no pulse. The electricity is working, but the pump itself is broken. A shock can't fix a broken pump. You have to find out what broke it and fix that. And this is where that deep wisdom, that vijnana, just shines. Because the shape of the PEE rhythm itself gives you clues. If you see a narrow, fast rhythm, it suggests there's some kind of physical blockage, maybe massive blood loss or a collapsed lung. But if you see a wide, slow rhythm, that points you towards a metabolic issue, like dangerously high potassium levels. You see, The rhythm isn't just a name, it's telling you a story about what you need to fix.
And finally, we get to asystole. This is the true flat line, the complete and total absence of any electrical activity. Now, it has the worst prognosis, but the most important thing here is to be absolutely sure it's real. Is a lead off? Is the machine unplugged? And crucially, have you cranked up the gain and checked other leads to make 100% sure you're not missing that tiny hidden whisper of fine VF?
So we've gone through the 4 rhythms, but that's just the knowledge part, right? That's the jnana. How do you go from just being able to name them to actually developing that deep intuitive wisdom, the vijnana, that you need to read them correctly when the pressure's on? Well, Dr. SB lays out this really simple 3-part path. First, you have to study. You have to understand the why behind the what. Second, you need experience. You have to see it again and again and again until recognizing those patterns is just second nature. But third, and this is probably the most important part, you have to reflect. After every single event, you have to stop and analyze what happened. That's the step that turns raw experience into real wisdom. All right, let's bring this all together and see how this moves from being, just a theory into something that becomes a life-saving intuition.
So let's try a little pop quiz from Dr. SB. Picture this. The monitor looks like total chaos, just a messy scribble. But the patient is moving around. So what's the rhythm? The answer? It's not a rhythm at all. It's artifact. It's just noise. The most important piece of data isn't on the screen. It's the patient sitting right in front of you. True wisdom is knowing which signal to trust.
And this brings us right back around to Dr. Purva and her big mistake. That feeling of failure, it's brutal. But Dr. SB reframes it in this perfect way. The problem isn't making a mistake. We all do that. The problem is not learning from it. That terrible moment of failure was probably the most powerful piece of education she could have ever gotten. Because now you can bet she will never, ever misfind VF again. And that all leads to this final, brilliant piece of advice. Follow the smoke to the fire. That smoke, your confusion, your mistakes, the things you don't understand, it's not something you should run away from. It's a signal. The smoke shows you exactly where the fire is. It's pointing you to the very spot where you need to dig deeper and learn more. This idea is so much bigger than just medicine. Think about your own job, your own life. What's the smoke that's obscuring things for you? Where are the areas that you're confused? Where do you only have that surface level knowledge? That's your smoke. And the real question this leaves us with is, are you willing to follow it to find your fire?